Today you're going to see a treatment using a little bit more advanced neurotoxin techniques. For this particular patient, I am using a tight dilution, which means I'm using a 1-to-1 reconstitution, and that means every hash mark holds a tighter concentration of neurotoxin than if I had used a standard reconstitution. And every injector has a preference as to how they prefer treating their patients. I happen to like a tight dilution. I feel like I can control it a little bit better. I like to add some saline in muscles that I want a little bit more spread, and then in the muscles that I don't want spread, I can keep it nice and tight. And the reason I would want that would be to minimize the risk for potential complications. This patient has a little bit of hooding in the eyes, and therefore I don't want a whole lot of spread on her frontalis, and that's why I chose to keep her dilution tight in the frontalis. But you can see we're treating the very common areas that we teach in level 1, but just on a tighter dilution. And that's sort of the beauty of aesthetics, is every provider does something different, and whatever works for them is, generally okay as long as we're practicing safely. You can see here I'm treating her masseters in 2 different locations, and the reason for that is, again, it's a tight dilution, it's not going to spread as far, and so I want to make sure that the entire muscle is being treated. We do treat her masseters pretty aggressively, and therefore I am treating her temporalis as well to help quiet that muscle so that she doesn't start to develop headaches, as that temporalis muscle would take over if we treat those masseters pretty heavily. And lastly, we are going to give her a lip flip. So this is a patient that is not quite ready for lip filler. She had filler about 6 months ago, but does have that lip that curls under when she smiles. And so when we relax the superficial muscle fibers of the orbicularis oris, the deeper muscle fibers will work a little bit harder and give her that flip. So you can end up seeing a little bit more pink lip or lip show when we treat those superficial fibers. So you can see here I'm going in and treating really superficially. I'm basically just under my bevel, and then we're relaxing those muscle fibers of the lip so that she can get a little bit more lip show. And this will just buy her a little bit of time until the next time that we do want to treat her lips. So we'd love to see you in a level 2 course soon so that you can start advancing those neurotoxin skills as well for your patients. Thanks for watching.